your head steady here. Just very gently feel along. It's below the brow bone. And then directly along the orbital socket here.
There to the left, there to the left.
Having that hypersensitivity on my face. Just a little bit there. Hi, Semide.
Hi, Dr. Perez.
Nice to see you today.
See you too.
Looks like I have you in for an extended cranial nerve assessment. Okay,
Yes.
so sorry to hear that. It looks like you've been experiencing some migraines and some kind of abnormal ocular symptoms recently. Okay.
Yeah.
Now, just kind of looking, I do see maybe just a little bit of inflammation already here. Can you tell me a little bit about your symptoms? Is there anything specific that's been happening aside from the migraines?
Well, I have noticed that I'm very sensitive to light, and it
Okay.
will potentially trigger the migraine or worsen it.
Okay.
So I like to just be in like a dark space, you know, and dark and quiet, just as low stimulus as possible.
Okay, so the outward stimulation is kind of what's been triggering the migraines.
For sure.
Now, can you tell me about how long this has been happening? I read that it's been a couple of weeks, but you noticed that it's been getting more severe, and that's why you came in.
Yeah, I haven't really had a whole lot of migraines previously, but I
Okay.
think after I had my baby, you know, I think my hormones are just kind of different now. And since then, I've been getting these migraines, and
Okay.
they have been getting worse. And I'm like, this is not normal.
Okay, so
So
it's something that now is affecting your quality of life.
Absolutely,
Okay.
and my ability to take care of my child. So.
Okay. All right.
Yeah.
So could be an increase of stress, could be something hormonal related, obviously, since you're postpartum now. So I'm going to have a look. I want to do kind of an external observation, see if there's anything that I think looks concerning. I do see just right away a little bit of swelling here, kind of just below your eye.
Yeah.
So could be related, could be unrelated. I'll do a couple palpations, see if the area is tender. Have you noticed any pain there or like soreness?
No, I haven't
really?
really noticed it. It's more so that that light sensitivity.
Just mostly light sensitivity?
Yeah, I do feel like, I would say like pain inside the eye, like not so much around it, but like inside.
Is it kind of like behind the eyes, like a pressure?
Yeah,
Okay.
exactly.
Okay.
That's
All
how
right.
it feels.
So that's common in people with migraines. They tend to feel almost like the eye is kind of pushing forward. So we can do some tests where I'll have you kind of increase that pressure just so I can see if it's more localized to that or if there's something else going on. So
Sure.
I don't notice right away any like redness or anything in the eye, so that's something also that I'll look at. Have you had any other lifestyle changes recently or any like lack of sleep quality, anything like that?
Yeah, my baby's teething a whole
Okay,
bunch,
okay.
so I haven't been sleeping very well these past few weeks, and
Okay.
perhaps that has to do with it too.
That's certainly could be a reason. I think actually what I want to do then is start with an assessment of your vital signs before we
Sure.
do anything else. I just want to see, sometimes migraines, headaches can be blood pressure related. Do you have any issues with hypertension or high blood pressure?
Not that I know of,
Okay.
but yeah, I'm happy to
Sure.
see if there's any issues with that.
So I'm just going to start by taking your blood pressure. We'll just see if it's elevated at all. Is this arm okay to take it on?
Sure.
Okay, so I'm just going to adjust your sleeve here if that's okay.
Yeah.
So I'm just going to look first to see if we get a decent reading here. Okay. Very strong arm to start with, so that's good. Just a little tighter. I want to make sure we get a fairly accurate reading here. Right. So I'm going to have you rest your hand here for me, and then if you're comfortable, I'm going to have you uncross your legs for me just for this portion of the examination. Sometimes can occlude blood flow if we have our extremities crossed over. So I'll have you just take very normal breaths for me. I'm just going to find the artery here to begin with, and then we can get started. Very good. All right. So like I said, just take normal breaths for me. You're going to feel it pump up fairly tight. And we're going to do a fairly slow release. Blood pressure is actually very healthy, about 121/82, so nothing of concern there. We can go ahead and remove this. So I'll just adjust your top here. Okay. Do you ever notice any sort of dizzy spells or any lightheadedness? Maybe when you stand up or when you sit down, or if you've been lying down for a while, is that something that you've ever experienced?
Not recently.
Okay. Good. All right. 121/82. Very good. All right, so I'm going to proceed with a very basic visual inspection to start with. So this is going to be kind of lengthy. I just want to have a look around and see if I'm noting any external swelling before I start with any palpations. So you're welcome to sit in whatever position is most comfortable for you.
Okay.
Right. So I do ask that you keep your eyes closed for now, as I don't want to expose you to any excess light. Obviously, we will be doing some lighted tests here, so I'm just gonna come in. I'm gonna start here on the right side. I'm just visualizing. I'm gonna go ahead and touch your face if that's okay.
Yeah.
Noticing just a little bit of swelling there on the left side. So come down. Let's have a look at the jawline. I do want to do a couple tests for TMJ a bit later on, see if that could be related here. And then looking for any signs of swelling. Just at the clavicular line, looking at the chest wall, kind of medial here. Okay. Just bring my light here. Just a little bit of swelling there for sure. Alright, just gonna look at the ear here. Beautiful earring.
Thank you.
Just looking for any signs of swelling at the thyroid. Sometimes it can be sort of what we might think would be unrelated, but because you are postpartum, I just want to have a look at the areas where sometimes can have some hormonal distensions. Do some palpation here. Just gonna have you turn your head very slightly for me. I'll have you turn this way. Actually, you may want to do a bit of a cranial assessment as well. Just kind of palpate in there on the scalp. put on a pair of gloves just briefly while I do some facial palpations here. Coming back in, I'm going to come fairly close to your face.
Yeah.
Just going to start at the crown here. And with any of these palpations, I want you to just let me know if you feel any tenderness. I'm just going to start by kind of grazing my fingers over specifically at the temporal region. I want to feel for any distension or anything that feels particularly concave. Also feeling for any temperature variation. Do you have any tenderness here at the sinuses as I press down?
No.
I'm just going to press down here at the very inner corner of your eye. Let me know if that hurts at all. I'm not noticing any excess tear production or anything here. So just going to do a bit of palpating at the scalp. Just feeling for any anomalies, any sort of lumps or bumps. You haven't had any hits to the head or any falls recently, right?
No.
Palpate along the ears, just a little bit of temperature variation. Just going to palpate at the lymph nodes. Thyroid. We'll come down clavicular line here. Can you clench your jaw for me, Semide, and just clench down? Okay. You can go ahead and relax. Just feel here between the brows. Some slight manipulation at the brow bone as well. Do you feel any pain or pressure here? Just right along the nose. Don't notice any inflammation at the gum line. So I'm going to feel directly over your eyes. I'd like you to keep your eyes closed, obviously, okay? Definitely let me know if anything's tender. You're going to feel some very mild palpation, mostly just kind of horizontal movement. Okay, sure. Just going to hold your head steady here. Just very gently feel along just below the brow bone and then directly along the just right here for some moment. I'm gonna have you keep your eyes closed, but look up for me. There you go.
Oh,
No, that's okay. You did a good job. Very good. Just have a look at the upper body as well for any swelling or excess tension here. Sometimes migraines can be related to some tension that we're holding in our upper extremities. So just gonna feel at the shoulder. Maybe just a bit tight here. A bit of tension at the neck as well. So I'm just gonna fill up the base of the scalp as well. Just a little bit of swelling there. Okay, all right, Semide. So I am noticing a couple areas of just a little bit of excess swelling. So I think we can go ahead and test for a couple different things here. So I have, this is called an ophthalmoscope. I'm just gonna take my gloves off. So I'm gonna have a look directly in your eyes. I have a couple different lights that I will use. This first one is magnified, so it's gonna allow me to look at the actual anatomy of your eye, okay?
Okay.
So I'm gonna have you look in a couple different directions. I'm gonna look at your optic disc, the nerves in your eye, that kind of thing. Might be just a little bit uncomfortable, but you just let me know if it's too painful, we can take a break.
All right.
So what I'm gonna do is turn this on. So I am going to come fairly close to your eye. So I'm gonna have you just turn this way to start with. Keep your eyes kind of lazily open. I'm gonna hold your eyelid up for you, okay? So start coming towards the eye. I'm just gonna kind of delicately hold it open here. And visualizing the ocular anatomy, I just want to make sure that there are no signs of obstruction. Do have some mild redness, just a little bit of pinkening there. Okay. Alright, I'm just going to change my magnification here. Do that one more time, just briefly here. I want you to look down for me. Good. Be noticing just a mild abnormality there, a little bit of nystagmus. Okay, so I'm going to come over on the other side. Alright, same thing on this side. I'm just going to start by coming in here at the outer corner. And coming in closer. Again, I do see a little bit of that sensitivity there. Just maybe some mild twitching as well. Okay. And last time, I'm going to have you look down for me. Slight variance on that side. Okay, alright. Give your eye just a bit of a break there. Okay, so as far as sensitivity, was that fairly uncomfortable? Would you say it was worse on either side? Did you notice any difference?
It felt a little worse on the right side, I would say.
Okay. Alright. Let's see, I have a couple different lighted tests that I want to perform, but I also want to give your eyes a little bit of a break. So, in between testing with the light, I'm going to do some ocular reflex testing now. You have a very natural reflex response in the eyes. It's just kind of a protective shield. Anytime something comes near your eye, your natural reflex is to blink. So I'm going to test if that reflex is intact and if you're having any oversensitivity. So for example, if something comes towards my eye, my natural reaction is going to be to close my eyes. If you're having some oversensitivity, if something comes towards your eye, I might see more rapid blinking or some fluttering of the eyelashes, that kind of thing. So I'm going to do some testing there. Can sometimes cause some tearing, so just let me know if it starts to get too sensitive. Okay.
All right, sounds good.
So I have a couple different things that I will test this with. Alright, so we are going to go ahead and get started, and for this test you can just relax. It's helpful if you're in a more relaxed position, in a more relaxed state. That way I get a natural reaction from you here. So we can, I'm going to alternate eyes closed and eyes open. So to begin, I want you to start with your eyes closed. Just move your hair here if that's alright with you. Make sure you have access to the area. And I will be testing both in and like around the eye area, as well as kind of near the forehead and temporal regions. So just making sure I have access there. Okay, so I'm gonna go in with that first sensation here, and I'm gonna start just so let's see some movement there. Good. So not seeing any signs of overreactivity just yet. I'm gonna kind of vary my good. I'm going to feel some bilateral testing. I have two identical tools here, so just heads up, you're going to feel me on both sides. So I'm going to do that again. This time I'm going to test with something that's going to produce a sound. Now you should still some reaction because you can hear the sound and you know it's coming towards your eye. So the idea is that your brain sends a response. Getting more reaction here on the right side though. Very good. Got a little puff of air here. This one is the one that can kind of make people tear up, so just a heads up. Actually, I think I might be getting delayed in response if nothing else. I'm not quite seeing as much reactivity, which leads me to believe there is a little bit of built-up pressure behind the eye, which makes sense considering you said you felt some kind of bulging. Definitely see a little You're gonna feel some mild vibration there, just like that. Interesting. Just a little bit of tenting at the brows. So I'm going to have you open your eyes for me, Semide. We're going to test that a little more briefly with the eyes open.
Okay.
So I want you to just kind of relax. You can kind of just leave your eyes lazily open, allow them to blink as needed. Okay? So I'm going to come in here. This time I'm not going to tell you where it's coming from. Mild tear. Good.
Good.
I know it feels a little bit weird. That's okay. You're doing a good job. So I'm going to come in again with the kind of aerated tool here. This one might make you tear up a little bit. That's totally fine. So again, just relax for me. Definitely some oversensitivity here on this right side. I can tell your response is just varied a little bit. Some slight strain there. Do one more just with the vibration here. Good. Right. Let's give you a break for just a second there. Any thoughts on that? Did you feel any difference? Was it worse with your eyes open than it was with your eyes closed?
Definitely felt worse with eyes open.
Okay. I definitely noticed a difference here on this side as compared to the other side. So we're going to switch back to another lighted test. This time I'm going to do some kind of varied testing here. So I'm going to shine the light in your eyes. I'm going to check for what's called pupillary constriction and dilation, just essentially the pupils of your eyes, which is the black part of your eye, can kind of expand and contract when light comes towards your face. I'm going to test it consensually, and then I'm also going to occlude, and we'll test individually as well. Okay. So for this, you're going to keep your eyes open. You can blink if you need to. I'm going to come in here. I'm going to start in the outer corner and slowly come in towards the eye. And seeing a healthy consensual response there. Definitely noticing a little bit of increased tear production, which is totally normal. Just gonna come down. Indirect exposure there as well. Okay. I'm going to do a varied test now. I'm going to occlude one side, which just means I'm going to cover one of your eyes. So I will hold this up for you. Same thing. This just allows me to test your eyes independently of each other. Very healthy constriction and dilation, though, I am noting, even on the right side. And good bilateral response there on the left side. So taking a break from shining it directly in your eye for just a minute, I have this tool here. This is slightly more dim, so it's not going to be as uncomfortable. So can you see, obviously, that this is lighted? Okay. So what I'm going to do is have you follow it for me. We're going to try to keep our head midline, so just don't turn at the neck. We're just going to follow with your eyes only. Okay? And I want you to let me know specifically if you notice any kind of floaters of the vision, if you start to see any rings or any light that's not supposed to be there. Sometimes this will induce some.
I think when you get to the edge of my vision right there, I can see
a little bit, like a circle?
Yeah.
Okay. And is that just on that side? Do you notice that on that side?
A little bit on that side, but it's very prominent on this side.
Okay. If we come up this way and down.
Yeah, I still see it.
Okay.
A little bit there too.
How about if I come farther away? So if I come from way out here and then very, very close towards your eyes.
That's okay. I think I don't see any other artifacts. Yeah, I still see it.
Okay. All right. So let's do this then. I'm going to cover your eye there again. Just want to make sure that you are just seeing it independently here on this side still.
Yes, very much.
And here as well.
Not as much now. It's just the one eye.
So that's why we test independently. That way I can make sure that it's not just accommodation. So now if I uncover, do you see it again on this side?
I do see it, yeah.
Okay, so it does look like it's isolated more so to that right side. All right. Very interesting. So I'm going to semi-occlude both sides here so you can see that this is kind of perforated here. So if I cover both sides, can you still see me? You should still be able to see something. I'm going to hold up a couple fingers. I want you to try to tell me what you see. Okay? So I'll start here.
I can't
you see anything?
No.
Go here.
3, 2. Can't see. Nothing.
Okay.
1.
Let's try it on the other side. Can you see my hand here?
Yes. 1. I can't see your full hand. 5.
Good.
2. Can't see your full hand.
You see that here?
2, 3.
So I'm going to test your visual field. I think we might have a little bit of I'm going to bring my hands in on either side just like this. I want you to tell me when you see it. So you should see something green, ideally on both sides. Okay, so we're going to start just here. Just tell me when you see it.
I see it. See it.
Okay.
See it.
Okay. I'm going to go the opposite. I want you to tell me when you no longer see it. So obviously you should see this here. Just tell me when it disappears.
Don't see it now.
Okay.
Don't see it now.
I'm going to do this middle one more time. So tell me when you see it.
Right there.
Okay. We test that independently. So just look here for me. Tell me when you see it on this left side.
There.
And on the right side.
There.
Okay, so a bit of a difference there. Okay, so I'm going to have you just look at this here in the middle. Try not to react to this other one. So let's give your eyes a break as a whole. I am noticing some differences there. I think I want to test a couple of your other cranial nerves and see if anything else is impacted or if this is just related to your ocular health. So why don't we switch gears and test a bit of your hearing. I have a couple different things that I'll test, just very basic. Do you find that you have any trouble hearing things on like a day-to-day basis?
I don't think so. Things feel louder than they should be.
Is there any muffling, or do you just think maybe it's like the overstimulation aspect of it that you just hear it more like a hypervigilance kind of thing?
Yeah, I guess I can't really, it's hard to describe, but things just feel like kind of louder and angrier.
Okay, that makes sense considering you have the oversensitivity of the light stimulation as well. So I'm going to have you close your eyes for me. I'm going to produce the sound, and you can either indicate verbally by saying yes, or that you hear it, or you can just nod your head, whatever is more comfortable for you, as long as I have some sort of positive indication. Okay.
Sure.
So I'm going to do a test. I want you to just tell me first, can you hear this?
Yes.
In here?
Yes.
Good. Okay, so now you'll just indicate to me when you hear it.
I hear it. I don't need, no. I still hear a little bit. Mm-hmm. Yep. There. There to the left. There to the left.
Now that's obviously a pretty soft sound, so did you feel like it caused you any sort of discomfort or nothing there?
No.
Go up just a little bit here. I'm going to use that same aerated tool from earlier. So you're going to feel a puff of air. Try not to pay attention so much to the sensation as the sound, okay?
Okay.
Good. Switching tools again, I'm going to use my tweezers. This time I'm going to try to make it just a little bit louder. I want you to tell me, one, if you can hear it, and also I'm going to alternate sides here. So I'm going to start on one side and end on one side. I want you to tell me where it ends, so where you hear it last.
Okay.
Okay?
Can hear it. Right. Can hear it. Right. Can hear it. Left. Can hear it. Left.
So I'm going to start from farther away. I want you to tell me when you hear it directly in front of your ear.
Right there. Right there.
And a bit of a delay there. I'm going to do that one more time.
Right there.
I'm going to test that left side one more time. Can you tell me just if you can hear this equally on both sides? Do you hear anything?
I don't hear anything at the moment.
Can you hear that?
Mm-hmm.
You hear it the same on both sides?
Yes.
You hear anything here?
Yes.
What now?
Yeah.
You hear anything here?
Mm-hmm.
And now?
Mm-hmm.
Good. Can you tell me if this sounds louder or this here?
The second.
Very good. And here? Number two?
Two.
Very good. Can Can you tell me if you feel vibration here?
Yes.
Mild vibration. And on this side.
Do.
Right. So I don't think there's anything particularly wrong with your ears or your hearing. I do think that's just some overstimulation that you're feeling with the sound, same as the hypersensitivity to light. So I'm not particularly concerned about like the audible portion of your hearing. I do want to go ahead and test a couple different things here. Let's do you have any allergies, Semide?
No.
So I have 3 different scents here, and I want you to try to tell me what they are. They're nothing super ambiguous. You should be able to tell. One of them is edible, one of them is floral, and one of them is just kind of an essential oil that's pretty common. Okay?
Okay.
So, bottles are not labeled, so you can't really tell what they are. I want you to just take a very gentle waft. They are very concentrated, so just let me know if you think you can tell what that is.
Kind of smells a little minty.
Okay.
Is that right? Don't know.
Try this one.
I don't know what that
And
is.
try again.
Oh, it's like lavender.
Very good, that is lavender. For this last one, I'm going to include one of your nares, so I'm just going to hold down your nostril here. Tell me what that is.
Or like a citrus, like an orange.
Very good, that is orange. Did very well there. That first one was eucalyptus, but I will give it to you. It does read minty.
Okay.
Good job. Alright. So now I have a couple things that I'm going to test in your hands. So I will have you close your eyes for me for this. I want you to just hold your hand out. I'm going to place an object in your hand. I want you to try to identify it for me.
Sure.
So I'm going to place it in your hand. You're welcome to feel around and try to identify that object for me.
It's like a paper clip.
It's a paper clip. Very good. And here.
It's like a puzzle piece.
It's a puzzle piece. Very good. And here.
It's one of those like hook things. What are they called? Carabiner?
Carabiner. Very
Yeah.
good. So I'm going to give you an object in both hands, and I want you to tell me if they are the same or different.
They're the same. Safety pin, I think.
Apologize for the ambulance. We appear to have an emergency case coming in. Same thing here. Tell me if they're the same or different.
They're the same. Just this one's larger.
Very good. Can you tell me if you have identical objects on either side, or what is different about them?
There's 2 puzzle pieces on this side and one on this side.
Very good. And lastly, you can relax your hands. I want you to open your eyes for me. Can you tell me if these are the same or different color?
That's like an orange, and that's almost like a yellow.
Very good. It's just very slightly different, but very
Yeah.
good job. Okay. Moving on, we are going to test a couple different things now. So are you noticing any kind of hypersensitivity to touch? Sometimes when we're having migraines or just the overall light sensitivity, we can feel touch just feels a little bit more overwhelming, or you're feeling particularly sensitive. Sometimes we can even have like a nerve firing sensation where you feel like a burning or almost like a static, kind of like if your hand falls asleep. So have you noticed anything abnormal in the realm of like physical sensation?
I would say that if like that's oversensitivity, like feeling touched out, but I don't know how much of that is just because I have a baby in my arms a lot of the time and, you know, on my breast and whatnot, so.
Okay, so maybe just mental overstimulation versus kind of like physical.
Yeah.
So I want to test a couple different things now. Let's see. I'm going to start with just my hands to start with, so because you have a child who's kind of providing that tactile sensation a lot of the time. I'm going to start with my ungloved hands. I'm going to touch you, kind of focused head, chest, upper body, a little bit of the hands. I want you to tell me if you start to feel any like stinging or burning sensation or any sort of pins and needles, or if it's just overall uncomfortable for you at all. Mm-hmm. Obviously, of course, if I touch you and you can't feel it or it feels particularly numb as well, then you can let me know. Okay? So for this portion of the test, you can either close your eyes or keep them open.
Okay.
So I'm going to start by just very gently just gonna alternate motions here. So just gonna lightly tap on the skin as well as soft brushing sensation, gentle pinch of some areas. Test that obviously around the eyes, as you said here. Having that hypersensitivity in my face. Sometimes tactile sensation can be a bit overstimulating. So in a way, we are kind of trying to induce some of those sensations and also just rule out whether or not they're more physiological versus neurological. So just physical response there for sure. All right. Would you say you felt anything kind of uncomfortable or abnormal? Any hypersensitivity of any of the areas there?
Like maybe just down here.
Okay.
A little bit. Feeling a little sensitive, for sure.
Okay. So that makes sense, especially where you're at in your postpartum journey. So kind of with breastfeeding and just having a child on you at all times, that's definitely something that makes sense. I'm going to retest that again with these kind of softer cottony wisps here. So same exact thing. So just let me know. This is going to help us rule out any signs of more peripheral neuropathy or any just oversensitivity, hypersensitivity, overstimulation. I'm just going to alternate there. So and tell me if that skin to skin provides any different sensation to you versus the tool.
I think the tool actually feels really nice. It feels different.
Okay, so it does provide a different sensory response.
Yeah, it feels soothing.
So your brain is definitely reacting to kind of physical touch versus neurological stimulation, which tells me something important. So that's interesting. All right. Let's see. These are a bit abrasive. I don't want to. Let's go with this one instead. So just varying the test based on what I think we need to alternate here. So I have this tool, it's very, very cold to the touch, so just pretty cold. So same thing, I'm going to touch you with it. Let me know if it's causing you any sort of discomfort similar to kind of the skin-to-skin contact, or if it's more relaxing as far as the tool. If you feel that it's cold, if some areas feel warmer, just any variance. Okay? Do you feel that here? Does it feel okay?
Yeah.
Particular attention to the areas where we tend to hold tension, so around our temporomandibular joint as well as just below the orbital socket. You had a little bit of swelling there, so it might feel a little bit different. And then again, testing for any variance in response to stimuli. Does that feel okay?
Yeah, that felt fine.
Were there any areas that were warmer or colder, or did it feel pretty cold everywhere that I touched you?
I think it felt pretty
About the same?
similar, yeah.
Okay. So lastly, I have two identical tools here. This is just like a surgical sponge. So I'm just going to do a light brushing motion. Now this kind of brushing across the skin can sometimes induce what's called peripheral neuropathy, or if it's that stinging sensation that I was describing to you. So if you start to feel any static or just overall, maybe even like itchiness of the skin, you can definitely let me know. So I'm going to start on your face, and then I will test this on your hands. That's where we tend to see more of that reaction. So I'm just going to start testing here. I also want you to tell me if it feels different on either side or if it feels the same.
It feels the same. 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 Same.
So I'm going to take your arm. Just going to test it on the other side there, Semide, so come down towards the wrist. Okay. So, as a whole, I think most of what you're experiencing is more so just a very kind of hypersensitivity, overstimulation, likely due to just kind of where you are in your postpartum journey, the fact that you've been breastfeeding. The most significant difference that I noticed in your test today was the overstimulation with physical touch, skin to skin contact. So there was very obvious differences when I used even like the softest tool, which just provides a very gentle kind of stimulus to the skin, versus when I did the same exact thing, but with my hands. Again, over the chest, it was the same thing, even with the cold tool, which can be pretty jarring because it is very cold. You seem to have more of kind of a visceral reaction to the skin contact there. So it's definitely something that I want to keep in mind, and I will notate accordingly. So I think the very last thing that I want to do is just have a listen quickly over your heart. I took your blood pressure at the beginning of the examination, and your pulse was well within normal limits. So this is going to help me notice if we have any kind of increase, if there's any rapidness there, if you're experiencing any signs of tachycardia now that we've kind of increased stimulation for the last hour. So I'm just going to listen over your chest. I want you to just breathe normally for me. Just listening for mostly for any rapidness, any signs of increased stress. Definitely just a little bit faster than it was at the beginning of our assessment. All right. So the good news is that I don't think there's anything really neurologically wrong. So you're fairly asymptomatic when it comes to your neurological response. The cranial nerves that I tested were well within normal limits. There was nothing I noticed. Maybe some mild abnormality with your visual field. Obviously some hypersensitivity to the light, but I do think that's just due to increased pressure. I think what we're looking at overall is overstimulation and probably a likely increase in your cortisol. So cortisol is your stress hormone. Obviously lack of sleep because you have a toddler. So you're already kind of doing the things that I would recommend homeopathically as far as, trying to get more sleep, decreasing stimulation, especially sound and sight. So if you have earplugs or headphones, as well as like an eye mask or just kind of dimming the lights in the room, cold compress over the head can tend to help, or like back of neck, things like that. Sometimes I like to recommend my patients sit in a cool bath, so not hot, because it can almost increase the stimulation as it opens your pores. But if you sit in like a room temperature or cooler bath, it can kind of just bring your cortisol down slightly. If you're able to soak your feet, that kind of thing. There's nothing from a neurological standpoint that I would say was abnormal with your cranial nerve exam. I think this is more kind of physiological, emotional response. Okay.
Good to know.
I could maybe recommend you some homeopathic therapies. We do have specialists that are working in office here, so things like acupressure, acupuncture, even massage therapy, if you think that would be helpful for you. But from like a Western medicine standpoint, I don't think that there's a whole lot I can do for you unless you start to feel an increase of that cranial pressure. Then we would maybe look into an MRI, but right now I think it's more so about decreasing that cortisol stress hormone level. Okay?
Yeah.
All right.
Thank you so much.
I can go ahead and give you some of those recommendations. I will kind of send you a couple links to your patient portal. You can click on them. There's just basic information as well as contact info if you want to reach out for any kind of different therapies as far as the massage. Okay?
Yeah. I think mostly I just need to get through this phase of
I think so too. Unfortunately, with toddlers, it's one transition after the other. So now we're kind of out of the baby phase, we're into the teething phase, the molar phase.
Yeah.
And then as we get older, there's growing pains and sleep regression. So unfortunately, it is very just touch and go, and your cortisol with that is going to be high and low, especially with breastfeeding. So really what we recommend for new moms is just try to relax as much as you can, reach out for help whenever you need it, and then if you can, treat yourself to things. Even a lot of nowadays are being covered by your insurance as far as acupressure, acupuncture, even massage therapy, chiropractic therapy, all things that kind of reduce some of that tension that you're feeling. Okay? All right.
Thanks for your recommendations.
Did you have any questions before we end your examination today?
I don't think so at the moment.
Okay.
Yeah.
I am going to send all of that information over to you, and you are welcome to reach back out if you feel like your symptoms are getting any worse, particularly with that pressure behind the eyes. Then we might refer you just for some imaging just to be safe.
Okay.
Okay.
All right. Thank you.
Okay, Semide. Now if you get home safely.